Hi friends, welcome to PharmaGrid. So in my previous video, we have discussed about liver function test. So today we will see about hematological tests. As you all know, blood contains three types of formed elements, that is red blood cells, white blood cells and platelets. These white blood cells are of five types, that is monocytes, lymphocytes, eosinophils, basophils and neutrophils. Hematology tests evaluate blood forming tissues, and related proteins. The most common is the complete blood count, that is CBC, which measures RBC count, total WBC count, hemoglobin, hematocrit, RBC indices such as mean cell volume, mean cell hemoglobin concentration, then reticulocyte count and platelet count. These tests diagnose and monitor conditions like anemia, infections, inflammation, and blood cancers. So, first we will start with red blood cells. They are also known as erythrocytes. First, under this red blood cells, the first test is the RBC count. This test reports the number of red blood cells found in a given volume of blood. This provides an indirect estimate of the blood's hemoglobin content. Coming to the normal values, for men, the normal range of red blood cells are 4.3 to 5.9 million per millimeter cube. For women, it is 3.5 to 5 million per millimeter cube. After puberty, females have slightly lower count than men because of menstruation and high androgen concentration in men. In anemia, RBC count decreased. This decrease causes a proportionate decrease in hematocrit and hemoglobin. Lifespan of RBC is 120 days. After it is removed by macrophages in spleen and other reticuloendothelial cells. Next test is hematocrit, which is also known as packed cell volume or PCV. This test measures the percentage by volume of packed RBCs in a whole blood sample after centrifugation. The hematocrit value is usually 3 times the hemoglobin value and is given as a percent or fraction of 1. Normal value is in the range of 42 to 52 percentage or 0.42 to 0.52 for men, and in case of women it is 37 percentage to 47 percentage or 0.37 to 0.47. Low hematocrit values indicate conditions such as anemia, overhydration or blood loss, and high hematocrit values indicate conditions such as polycythemia vera or dehydration. The hemoglobin test measures the grams of hemoglobin contained in 100 ml or 1 liter of whole blood and provides an estimate of the oxygen carrying capacity of the red blood cells. The hemoglobin value depends on the number of RBCs and the amount of hemoglobin in each RBC. Normal values are 14 to 18 gram per deciliter for men, and for women it is 12 to 16 gram per deciliter. Low hemoglobin values indicate anemia. Coming to RBC indices, these tests provide important information regarding the red blood cell size, hemoglobin concentration, and hemoglobin weight. They are used primarily to categorize anemias, although they may be affected by average cell measurements. A peripheral blood smear can provide most of the information obtained through RBC indices. Observations of a smear may show variation in RBC shape, which is known as poikilocytosis, as might occur in sickle cell anemia, or it may show a variation in RBC size, which is known as anisocytosis, as might occur in a mixed anemia, as in case of folic acid and iron deficiency anemia. Under RBC indices, the first test is mean corpuscular volume, or in short we can say MCV. It is the ratio of hematocrit to the RBC count. It essentially assesses average RBC size and reflects any anisocytosis. It is nothing but the ratio of hematocrit to the RBC count. Normal range for MCV is 80 to 96 femtoliter per cell. Low MCV indicates microcytic, that is undersize RBCs, as occurs in iron deficiency, and high MCV indicates macrocytic RBCs. Macrocytic means oversize, as occurs in a vitamin B12 or folic acid deficiency. Next one is mean cell hemoglobin or MCH. This MCH assesses the amount of hemoglobin in an average RBC. That is, MCH is defined as it assesses the amount of hemoglobin in an average RBC. The normal range for MCH is 27.5 to 33.2 picogram per cell. It truly elevated in the presence of folate deficiency due to the presence of macrocytic RBC. It is decreased in iron deficiency anemia. A low MCH corresponds with hypochromic RBCs. Mean cell hemoglobin concentration or MCHC represents the average concentration of hemoglobin in an average RBC. It is defined as MCHC is equal to hemoglobin into 100 divided by hematocrit. Normal range for MCHC is 33.4 to 35.5 gram per deciliter. Low MCHC indicates hypochromia, that is pale RBCs resulting from decreased hemoglobin content as occurs in iron deficiency. So, in the previous slides, we have seen certain terms that is like microcytic, hypochromic, normochromic, etc. So, we will see what all are those terms. So, anemia is broadly classified by the size and hemoglobin content, that is color of red blood cells. Hemoglobin is the protein that carries oxygen and gives blood its red color. The terms hyperchromic, hypochromic, and normochromic describe the concentration of hemoglobin in these cells. So, hypochromic anemia. So, from the name itself, hypo, which means the red blood cells have a lower than normal concentration of hemoglobin, appearing paler under a microscope. These cells are usually also smaller than normal, which is known as microcytic. Okay, so this is what you meant by hypochromic anemia. Hypo means there will be lower than normal concentration of hemoglobin. Then normochromic anemia. Here, the RBCs have a normal amount of hemoglobin and a normal color. But there are simply not enough RBCs in circulation. The cells are typically normal in size, hence they are known as normocytic. Next is hyperchromic anemia. Here, the RBCs appear to have a higher than normal concentration of hemoglobin. In a clinical setting, this is extremely rare. It typically occurs due to a cell shape change rather than an excess of hemoglobin. So this is how a microcytic hypochromic anemia looks like. And this is normocytic normochromic and this is macrocytic normochromic. Moving on to the next test, which is red blood cell distribution width, that is RDW. This is a relatively new index of RBCs. Normally, most RBCs are approximately equal in size, so that only one bell-shaped histogram peak is generated. Disease may change the size of some RBCs. For example, the gradual change in size of newly produced RBCs in folic acid or iron deficiency. The difference in size between the abnormal and the less abnormal RBCs produces either more than one histogram peak or a broadening of the normal peak. Normal ranges 11.5 to 14.5%. This value is used primarily with other tests to diagnose iron deficiency anemia. An increased RDW is found in factor deficiency anemia, for example, iron, folate, vitamin B12 deficiency anemias. A normal RDW is found in conditions such as anemia of chronic disease. The RDW index is never decreased. Next one is reticulocyte count. The reticulocyte count provides a measure of immature RBCs. Reticulocytes are known as immature red blood cells, which contain remnants of nuclear material which is known as reticulum. Normal red blood cells circulate in the blood for about 1 to 2 days in this form. Hence, this test provides an index of bone marrow production of mature RBCs. Reticulocytes normally make up 0.1% to 2.4% of the total RBC count. Increased reticulocyte count occurs with such conditions as hemolytic anemia, acute blood loss, and response to the treatment of a factor deficiency, for example, an iron, vitamin B12, or folate deficiency. Polychromasia is a tendency to stain with acidic or basic dyes. This condition is noted on a peripheral smear laboratory report, usually indicates increased reticulocytes. Decreased reticulocyte count occurs with such conditions as drug-induced aplastic anemia. ESR or erythrocyte sedimentation rate measures the rate of RBC settling of whole uncoagulated blood over time, and it primarily reflects plasma composition. Most of the sedimentation effect results from alterations in plasma proteins. Normal ESR rates ranges from 0 to 20 mm per hour for males and from 0 to 30 mm per hour for females. ESR values increase with acute or chronic infection, tissue necrosis or infraction, well-established malignancy, and rheumatoid collagen diseases. ESR values are used to follow the clinical course of a disease, demonstrate the presence of occult organic disease, differentiate conditions with similar symptomatology. For example, angina pectoris. In this condition, there will be no change in ESR value as opposed to a myocardial infarction where there is an increase in ESR value. So we have finished with the RBC test. Moving on to the next one, that is WBCs. They are also known as leukocytes. So among this, the first one is the WBC count. This test reports the number of leukocytes in a given volume of all blood. Normal values range from 4,000 to 11,000 white blood cells per millimeter cube. Increased white blood cell count, which is known as leukocytosis, usually signals infection. It may also result from leukemia, tissue necrosis, or administration of corticosteroids. It is most often found with bacterial infection. Then decreased WBC count, which is known as leukopenia, indicates bone marrow depression, which may result from metastatic carcinoma, lymphoma, or toxic reactions to substances such as anti-neoplastic agents. The WBC differential test evaluates the distribution and morphology of the five major types of white blood cells. The granulocytes such as neutrophils, basophils, and eosinophils, and the non-granulocytes such as lymphocytes and monocytes. A certain percentage of each type makes up the total WBC count. So starting with the neutrophils, neutrophils may be mature or immature. Mature neutrophils are polymorphonuclear leukocytes, also referred to as polis. Segmented neutrophils or segs. Immature neutrophils are referred to as bands or stabs. Then what do you mean by chemostaxis? Neutrophils that phagocytize and degrade many types of particles serve as the body's first line of defense when tissue is damaged or foreign material gains entry. They congregate at sites in response to a specific stimulus through a process known as chemotaxis. So here you can see the normal percentage values for white blood cell differential. So for polymorphonuclear leukocytes, normal range of 50 to 70 percentage. For bands, it is 3 to 5. Lymphocytes, 20 to 40 percentage. For monocytes, 0 to 7 percentage. Eosinophils, 0 to 5 percentage. And for basophils, it is 0 to 1 percentage. Neutrophilic leukocytosis. So this describes a response to an appropriate stimulus in which the total neutrophil count increases. Leukocytosis means increase in white blood cell count. So neutrophilic leukocytosis means total neutrophil count increases, often with an increase in the percentage of immature cells, a shift to the left. This may represent a systemic bacterial infection such as pneumonia. Certain viruses, for example, chickenpox, herpes zoster, then some rickettsial diseases, for example, Rocky Mountain spotted fever, some fungi and stress, for example, physical exercise, acute hemorrhage or hemolysis, acute emotional stress, may also cause this response. Other causes include inflammatory diseases, for example, acute rheumatic fever, rheumatoid arthritis, acute gout, then hypersensitivity reactions to drugs, tissue necrosis, for example, from myocardial infarction, burns, certain cancers, then metabolic disorders such as uremia, diabetic ketoacidosis, myelogenous leukemia, and use of certain drugs such as epinephrine, lithium, etc. Next condition is neutropenia. Neutropenia means a decreased number of neutrophils. This may occur with an overwhelming infection of any type. For example, bone marrow is unable to keep up with the demand. That means there will be decreased number of neutrophils. This condition is known as neutropenia. It may also occur with certain viral infections such as mumps, measles, then with idiosyncratic drug reactions and as a result of chemotherapy. Neutropenia is defined as an absolute neutrophil count, that is ANC, of less than 1000 cells per millimeter cube. Some define absolute neutropenia as an ANC of less than 500 cells per millimeter cube. The ANC is calculated by multiplying the percent of neutrophils by the total WBC count. So let's see an example. So let the WBC count be 4000 cells per millimeter cube and neutrophils at a 60%. So ANC is calculated as 4000 into 0.6, that is equal to 2400 cells per millimeter cube. Moving on to the next type of white blood cells, that is basophils. These basophils stain deeply with blue basic dye. Their function in the circulation is not clearly understood. In the tissues, they are referred to as mast cells. Basophilia, an increased number of basophils, may occur with chronic myelogenous leukemia as well as other conditions. A decrease in basophils is generally not apparent because of the small numbers of these cells in the blood. Next is eosinophils. These cells stain deep red with acid dye and are classically associated with immune reactions. Eosinophilia means an increased number of eosinophils may occur with such conditions as acute allergic reactions, for example, asthma, hay fever, drug allergy, and parasitic infestations, for example, trichinosis, amoebiasis, etc. Moving on to the next type of white blood cells, that are lymphocytes. These cells play a dominant role in immunological activity and appear to produce antibodies. They are classified as B lymphocytes or T lymphocytes. T lymphocytes are further divided into helper inducer cells, that is Th4 cells, and suppressor cells, that is Th8 cells. Lymphocytosis means an increased number of lymphocytes usually accompanies a normal or decreased total WBC count and is most commonly caused by viral infection. Lymphopenia means a decreased number of lymphocytes may result from severe debilitating illness, immunodeficiency, or from AIDS, which has a propensity to attack Th4 cells. Atypical lymphocytes, that is, T lymphocytes in a state of immune activation, are classically associated with infectious mononucleosis. Coming to monocytes, which are phagocytic cells. Monocytosis means an increased number of monocytes may occur with tuberculosis, subacute bacterial endocarditis, and during the recovery phase of some acute infections. So in this slide, you can see the significance of high and low white blood cell counts. And these are the different types of white blood cells. And here you can see the high count, what they may indicate, and low count, what they all indicate. So first of all, neutrophils, high count may indicate bacterial infection, burns, stress, inflammation, whereas low count may indicate radiation exposure, drug toxicity, vitamin B12 deficiency, then SLE. Lymphocytes, high count may indicate viral infections, some leukemias, infectious mononucleosis, then low count may indicate prolonged illness, HIV infection, immunosuppression, then treatment with cortisol. Monocytes, high count may indicate viral or fungal infections, tuberculosis, some leukemias, other chronic diseases. Low count may indicate bone marrow suppression, then treatment with cortisol. Then high count of eosinophils may indicate allergic reactions, parasitic infections, autoimmune diseases. Low count may indicate drug toxicity, stress, acute allergic reactions. Then high count of basophils may indicate allergic reactions, leukemias, cancers, hypothyroidism, whereas low count may indicate pregnancy, ovulation, stress, hyperthyroidism. Moving on to the next type of cells, they are platelets. They are also known as thrombocytes. These are the smallest formed elements in the blood and they are involved in blood clotting and vital to the formation of a hemostatic plaque after vascular injury. Normal values for a platelet count are 1.5 to 3 lakh cells per millimeter cube. Then thrombocytopenia means a decreased platelet count can occur with a variety of conditions such as idiopathic thrombocytopenic purpura or occasionally from such drugs as quinidine and sulfonamides. Thrombocytopenia is moderate when the platelet count is less than 1 lakh cells per millimeter cube, whereas this thrombocytopenia is severe when the platelet count is less than 50,000 per millimeter cube. So again, this is a summary of formed elements, mainly the platelets, white blood cells, then red blood cells, then the five main types of white blood cells, that is the neutrophils, lymphocytes, monocytes, eosinophils, basophils, and their normal values. So I hope this topic is clear for everyone. If you have any doubts, you can mention in the comment section. So thank you for watching and all your support. Please don't forget to like, share and subscribe. Have a great day.